Over 80% of people experience mystical or non-ordinary states of consciousness at the end of life. They begin with lucid dreaming, seeing non-human, non-physical entities, being filled with peace, having psychic awareness, then out-of-body experiences, near-death experiences. These are universal.
Do you support MAiD at all, or are you unequivocally not in support of MAiD?
Right. After being with hundreds upon hundreds upon hundreds of people at the moment of death, I've concluded that MAiD is an inappropriate response to suffering.
I'm just over the moon about the fact that we get to sit down with David once again. David McGinley, the high priest, the only man I've ever seen who literally needs to bend down to walk through a door made for normal people. I'm glad you didn't smoke your head on the way in here. David,
this is is this the third appearance?
It's the third appearance.
And
Wonderful.
I think was it episode 200 or 100 or
100.
both?
Oh, right.
Yeah.
100 was the second. Thanks for having me back.
Yeah. Yeah, it's great. I feel like it's been too long now at this point because like twice in the first 100 episodes and then not for a long time. I feel like this has been long overdue.
But we got a lot of good stuff to talk about.
That's true. That's
a lot
true.
of controversial stuff to talk about. I'm really excited. Hey, folks, if you wouldn't mind doing me a huge favor and just take a quick second to hit that subscribe button and, of course, hit the thumbs up button as well. And hey, look, if you don't have time to watch the video right now, I ask that you just take a second to add it to your watch later playlist. It would mean the world to us. And thanks for being here. All right, without further ado, let's get back to the episode. David, for folks who may be newer to the podcast, tell the listeners a little bit about who you are.
Yeah, so for 25 years, I was a chaplain. We're called psychospiritual therapists in cancer, palliative, and intensive care at the hospital here in Halifax. So I swam with people in suffering and helped them float and find their best self in the hardest times. Right. I'm also a Lutheran pastor, so I've had churches, and I'm a 4-time cancer survivor and very lucky to be alive. I've had a near-death experience. I've had several mystical experiences, and now I've recently retired as of 1 year ago, just about this week, from the hospital, and I'm off. I have a private practice, and I'm walking by the ocean, and I'm soaking in the life that I see so many people fighting for.
And you also just released a book. It is out today, the moment we are recording this.
So semi-retired because you still have to promote the book.
I got to promote the book.
The book is titled Early Exits, Spirituality, Mortality, and the Meaning in an Age of Medical Assistance in Dying. There's the controversy that I kind of alluded to there. We're going to be talking about MAiD. But go ahead.
I wanted to ask, so your job is, I imagine that your job, and we've talked about this before, is almost like an embodiment of your belief system. And so when you retire, it's not like you retire believing in the things that you believe in. So what does retirement sort of mean for you? You're not going into work and get paid to do the work that you do, but because
if I'm an accountant, I retire,
you don't do accounting anymore.
I retire from my belief in Excel spreadsheets.
No, but you don't do accounting anymore. But when you retire, it's your profession is what, part of.
I retire into an even broader creative process. I have a private practice in the city, so I support people who are suffering and struggling, but that's 1 day a week. The rest of the time, I practice what I had preached. Embrace this life. Be aware. Know yourself. Feel the joy. Share the love. Be present with whatever arises. And publish a book and do the public speaking and seminars and do all that stuff. But it really is all about embracing life and sucking the marrow out of it, right? Enjoying it, feeling it, the highs and the lows. And I'm just bumbling along trying to be human in the end, like the rest of us.
Totally.
So So we mentioned that that the book touches on MAiD, and that's kind of the primary theme of the book, looking at MAiD from your point of view and the way that it's being used, the way that it's being pushed forward through legislation. And we've covered MAiD on the podcast, I mean, since day one. Ever since MAiD was even talked about as being considered an option for Canadians, it was a topic that we've dived into. And from that moment, when we first started talking about it till now, I would say that as a whole, we are pro MAiD, but as the legislation started to shift and the rules surrounding it started to change, I'm going to speak for the three of us in saying that I don't think we fully agree on all of the different decisions that were made that surround MAiD. Now, regardless of how we feel about it, I'm curious to ask you, before we dive into what we're going to dive into, do you support MAiD at all, or are you 100% unequivocally not in support of MAiD?
Right.
Period.
So after being with hundreds upon hundreds upon hundreds of people at the moment of death and supporting thousands of people as they wrestle with mortality, I've concluded that MAiD is an inappropriate response to suffering. And the reason is pretty plain and supported by the research. The reason people request MAiD is because not of physical suffering, it's because of what's called existential distress. We're terrified of dying. Okay. We don't like how we can no longer function and be in the world as we know ourselves to be through all the decades. We don't want to put our family through it. We're scared of the suffering that's ahead. We don't see the point. So that is called existential suffering. Loss of meaning, loss of hope, loss of purpose that compromises your identity. That's equivalent or a synonym for spiritual distress.
Sure.
We're using a medical procedure to treat a spiritual condition, existential distress. So it's not physical suffering. Now, yeah, there are bumps in the road, and I know people struggle physically and experience pain. I've been there for 25 years. But the vast majority of people who receive MAiD are not physically suffering an unbearable state at that moment. They sure don't like dying. Who would? So that's the first that's the first trouble I have with MAiD. The second is that we're talking about it without being aware of the fundamental dynamics at play. So the people who develop the legislation, the people who advocate for it, the people who desire it, and the people who've received MAiD are all, I'm pretty confident, unaware of what I'm about to talk about. But it is a fundamental dynamic in dying. So I'm trying to deepen the conversation through this book, raise awareness of this dynamic that I'll explore, and probably help slow it down or shift the perspective so that we can die wise, as Stephen Jenkinson always talked about.
And so in the like, I think the lens through which I've always thought about MAiD, and I think through the lens that you just expressed, like the way that the legislation comes about, because when policy is being made, it's probably, they're probably not thinking about it through this existential or spiritual distress lens, that people are, we're thinking about the physical period in which people are suffering. And so I suppose the kind of like the question there is like, how do we separate those two things where both are probably true, that somebody is going through a spiritual or existential distress about the, meeting their maker and coming to the end of their life and all of the things that come with knowing that experience is on the horizon, or that you are slowly moving into that experience as like an illness progresses, and the physical aspect that will eventually come. Like, is there a point in the journey of somebody where MAiD starts to make sense? Like when somebody gets to a point of like physical suffering, I suppose, like,
I mean, to jump in there and say, like, when before MAiD, you know, some people, I don't think it's a huge secret that sometimes healthcare professionals might give like an extra dose of painkillers that might lead to the end of the person's. It's like, okay, they're at this point, it's maybe time to let them go. I mean, that's similar. It's just like at the very
right.
end,
So let's
right?
identify two key things. The first is shock. Dying is not painful. Disease process is painful.
Mm-hmm.
But the dying process is really predictable for the vast majority of illnesses, which means it can be managed. Second, let's look at it, the anthropology of the situation we're in. With the advent of morphine, death had been accelerated for illnesses. Yeah, people had done that. Just as people were put out of their misery on a battlefield, or, you know, when you're living in the woods, and, you know, yeah, this happens all the time. But with the advent of morphine and the development of universal pain protocols, we know how to manage the physical suffering. And that's the purpose of palliative care. Maximize quality of life while you have some life left. There's no reason in today's society why anyone should have to be suffering physically as they die.
Mm.
It's just not. But people do. Why? Well, it's a human factor. People worry, and I hear patients say this: I'm dying, but I don't want to get addicted to the morphine, so I'm going to resist it, which is like, fill your boots.
Yeah.
I could use a new addiction some
Yeah.
days.
Oh man. Yeah. Load me up with the addictions moments before. I mean, it's like, that's when you're living.
It's great.
When you're dying.
And having had so many operations, I enjoy morphine
Mhm.
appropriately when it's given to me. The second thing is, they don't want to descend into a state of unconsciousness, which is a limbo for them, and have their family hovering and waiting. But when you are in that state, you're not self-aware. So that's sort of a tension.
Mm.
Your rational mind at this point says, of course, I don't want to be hanging around like that. Third factor, the inability in our culture to see purpose and function in your deterioration. People talk about dignity, and that's a big word in the MAiD conversations. But we're talking about a personal functional dignity there. When you're a newborn, right, you're totally dependent on everyone to bathe you and feed you and move you and everything.
No doubt.
And you have infinite dignity. Why is it any less true when you're on your deathbed? That should be a community building event that draws the people together. But in a society, a culture in which autonomy is an intoxicant, in which loneliness is epidemic, in which people do die alone, and in which we are sheltered from death, and so we don't witness what its natural process is like. It's no wonder that MAiD appears upon the scene. But still, I'm saying it's an inappropriate response to the suffering, and we can do a lot better.
When I, for years, as someone who lives with a progressive illness and someone who spent the majority of my life convinced that, you know, my illness was going to take my life before the time I, you know, turned 30. I spent so much time meditating on death, and I got to a point where I was very much open to it and embracing the idea of my own death. But when I would think about the people that I love and their death, I couldn't handle it.
The problem isn't dying, it's leaving.
Mm-hmm. Yeah. So when I was struggling with this notion of death, or thinking of the people that I love around me dying, during COVID, I decided to take a death doula training. Not because I have any intentions of practicing as a death doula, but I just took it as a way to deepen my understanding of death, to deepen my my death literacy. And one of the biggest takeaways for me in doing that training was like a profound shift in the way that I viewed death as a whole, where, and if you had asked me this prior to taking this, I would, if someone said, do you find that there is some element of, I guess for lack of a better word, beauty in the dying process? I probably would have been like, oh yeah, sure. Yeah. Like, yes, there's a beauty in death based on my history of meditating on death. But after taking this course, that understanding of the beauty that is involved in death had expanded so greatly.
Okay, so why? What is the nuance of that?
It was based on what you just spoke about, which is that there is a way to approach death in where it brings community together, unlike anything else. And so when we go into as death doulas, one of their jobs is to sit with the person who is dying and to try to help them create a legacy or try to help them make meaning of the time that they had here. And there's all these different like exercises that you can, that you talk about that you can do. And more often than not, those exercises involve bringing in a lot of the people in that person's life to help honor that person's life, to help share memories, to help, weave this quilt, if you will, of all of the different facets that this person has brought to the world and how they've had an effect on somebody else. And I've been around, I've had a few people die in my life. And when I was learning about this technique of like building a legacy with the person who's dying, it struck me because I was like, wow, I don't think anybody that I know who has died has had that opportunity. And there's something so beautiful.
So let me speak to that from the perspective of one who would support MAiD. What would they say? Well, I've been present at really beautiful deaths by MAiD that were community building, in which everyone said, thank you, I love you, forgive me, and goodbye, the most important words. They've developed creative rituals. They've unpacked for the journey. They've given their possessions away with gratitude, and they've been at peace. So what's wrong with that? So here's the challenge. The level of consciousness and presence that we're talking about near the end of a natural death is so unlike the level of consciousness and presence in a MAiD procedure. When my rational mind and who I think I am, my attachment to my identity, is still intact. MAiD becomes, and here's that material I was going to speak to. There's going to be a dense statement here.
Yeah.
The dying process is perplexingly, exquisitely calibrated to deconstruct our ego identity in the reverse order that it formed in order to move us to the final stage of human development, which is transcendence.
Okay, so say that again. I'm just going to type it into ChatGPT and say, explain it to me like I'm a dumb 5-year-old.
Right, that's what my wife said. When you say this, okay. So we are attached to who we are through the body, our perception, our senses, our mind, our thoughts, our feelings, our experience, right? And that's the human journey. But dying strips that all away until you're left in the bed, let's say from cancer. And you don't like it. That's existential distress, resisting and pushing away the finality of you shifting from what is fundamentally a human doing to a human being. No longer thinking, acting, functioning like you've been used to all of your life. You're returning to a state of simple awareness. That is the only thing you're left with, I trust, after you die. Now, yeah, you're going to have experiences, but we're talking about a level of consciousness so far beyond this, the rational mind is not able to comprehend it or imagine it. So, what would be the purpose in doing it? I was sitting with a guy, he was dying, and he said, tell me why I shouldn't do MAiD. I said, that's not my job. I'm here to support whatever you
You
decide.
just gave him your book. You're like, here, read this. Read these 500 pages.
Anyway, he really, really pushed me and challenged me. So after checking with my ethics advisor, I came back and I said, okay, can you imagine that in your dying and your utter dependency as you lay unconscious in the bed with your family around you, can you imagine you're teaching the ultimate lessons of life? How not to abandon suffering, how not to turn away from pain, how to let others enfold you in compassion, how to teach them about the depths and the raw nature of their humanity, how to let them anoint your body with their tears, how to make an investment in the spiritual intelligence of our culture by being real with what we all must face, which is our end. Can you do that without resistance, but with a perplexing equanimity, trusting it will come upon you? You don't need to figure it out. Can you trust it so much that you will ask for pain medication ahead of the pain so you don't suffer unnaturally? Can you take the remaining time of consciousness you have to say, thanks, I love you, forgive me, and goodbye?
The ultimate expression, the ultimate expression that you can't comprehend until you actually experience it, sort of equivalent, where I've talked about this a couple of times on the podcast in relation to other things where
here we go.
So here we go. We're going to be talking about how to invest in the S&P 500.
And then his bike accident.
Nope, neither of those things.
Okay.
Where Brian and I ran a yoga retreat years ago in Peru, and we did 3 or 4 days at this, really remote in the mountains retreat center, really off grid, and then we all as a group went and hiked the Inca Trail afterwards, and it was an amazing experience. And on the second day, there's one day in it where you crest the actual peak of a mountain through these stairs that have been there for hundreds of years.
It's called Dead Woman's Pass.
And it literally is like a scene out of Lord of the Rings, where you are on the face of a mountain going up these stairs that were carved out hundreds of years ago, and you actually crest the actual peak of a mountain and go down the other side. And the weather is often terrible. So the first day is really nice weather. It's it's basically just a long, beautiful walk. Second day is legit challenging.
Went from 30 degrees and sunny to 0 degrees and snowing at the top.
Yeah. And we're all going over, and we've got packs on, and we've got our ponchos on, and we're talking, levels of fitness from very fit to I walk around the city. And so at the end of the whole trip, it was a very trying day, and to mix in that awful weather. And at the end of the whole trip, we're in this town that's right next to Machu Picchu. And Brian and Dennis and I, Brian's brother Dennis, we were talking with two of the women that were on the retreat with us, and we were like, wow, what an experience. That was so, I feel so accomplished. By the way, everybody, I have a baby on my lap.
No kidding.
That was such an incredible experience. I feel so accomplished. Going through all that hardship was, taught me so much. And now that I'm on the other side of that, it's this experience and growth that I'll never forget, and that will forever, change me. And two of the I think one of the women was like, nah, yeah, I could really take it or leave it.
Yeah. Basically that side. It was too hard and it wasn't enjoyable.
And Brian and Dennis and I were like, what are you, but you're on the other side now. And she was like, yeah, I'd rather have not done it. And we were like, what? I can't believe, it just, after going through it, there was so much, there was parts of the experience that were absolutely horrible. And in the actual moment, it was actually brutal. But then being on the other side of it and getting through that, there was so much that we learned and so much that we taught, and not just to ourselves, but to everybody around us, and the people that were around that supported everybody else, and and lagged behind with somebody who was struggling when they could have just walked on and gone further by themselves. And so it was just a really amazing experience. And I sort of am thinking about this dying process in a similar way here, where it's are you foregoing this the ultimate growth
Right.
at the very end where you transcend?
So dying accelerates that growth or that opening and awareness. But let's not glorify dying. Let's not put an artificial or a synthetic purpose on suffering, because it can be brutal.
Mm-hmm.
I've seen it. I've held people as they have been in agony. And that's most of the time because we didn't stay ahead of the pain. Now, there's some kinds of pain that medication won't touch, which means it's complex pain, and you have to have multi-pronged approach. Nonetheless, universally across all cultures, time periods, cognitive level of development, belief systems or no belief systems, there is a universal pattern that the dying process opens you to a different state of consciousness that is manifest in what our culture still wrestles with and yet finds so entertaining: transpersonal states of awareness or mystical phenomenon. Great study showed that, and it was a few thousand people, over 80% of people experience mystical or non-ordinary states of consciousness at the end of life. Those are fleeting moments. They aren't protracted, but they're practically universal. They begin with lucid dreaming. They expand into seeing non-human, non-physical entities, being filled with peace, feeling, having psychic awareness of where other people are, what they're doing, then out-of-body experiences, near-death experiences. These are universal. And Dr. Gregory Shushan is one of the great anthropological researchers who looks at it across cultures and time periods. Universal. With MAiD, we shut you off before you reach that state of consciousness. What an incredibly impoverished perspective on what it is to be fully human. Now, again, the people who develop the legislation and those who've received MAiD and those who carry it out aren't aware of how common and normal these are, or this complex process of ego deconstruction that I'm talking about. Suffering becomes functional as we turn towards death without resisting it. It changes our relationship to our own experience.
Yeah. I want to just come back to this idea of the ego and the deconstruction of the ego when it surrounds death. One of the conversations that we had on the podcast that has always stuck out with me was a conversation that we had with a man named Thomas Hartle. And Mr. Hartle had stage 4 cancer. He was terminal, and he was terrified of dying. So he was in that state of existential distress, that spiritual distress. And he was the first Canadian patient that was legally given medical psilocybin specifically in order to deal with his spiritual distress.
Effective, isn't it?
And it
Very.
and so hearing him, and this is a guy from Alberta. He's a bit of a nerdy fella. Worked in like IT or something like that.
Never did drugs.
Wasn't a drinker. Never even smoked a joint. He was as innocent as my mother, I would say, in terms of like the illicit things that he kind of took part in over his time while he was.
But he was a big data guy.
And so he read the data on psilocybin and its effects. And what he said after going through this was that it 100% completely transformed his fear from this terror of this idea of dying to this overwhelming acceptance.
And even curiosity.
Yeah.
I reference him in the book. So I'm very excited about psychedelics for palliative care. The research is really solid, showing one dose is effective in dissolving the fear of death. And
that's crazy.
It's
one big dose.
Under guidance with a proper setting.
Yeah.
But I think this is really hopeful. So there's a chapter on psychedelics.
Yeah. And it's, I'll say personally, I'm very much pro psychedelic, and I've dabbled with psychedelics for many years, recreationally. I had an experience one time with what's called 5-MeO-DMT, which is a very, very potent psychoactive psychedelic, and my intention. This was a ceremonial thing. We had to set intentions, and my intention with that was, right before you break through, right before you cross over, right before you take your dose, you're meant to state this intention to yourself. And when I went into it, my intention, the words that I spoke right before I crossed this threshold was, I want to die. And I said that to myself, and I took this 5-MeO-DMT. And when I came out of that experience on the other end, I was, and still to this day, am 100% convinced, because the words cannot describe the experience that I had. I experienced the closest thing I think you can come to without actually going through what you went through, which is that I died without dying.
Right.
And it was so glorious.
I feel the emotion. I see the emotion in you right now, because it lives in you. Mm-hmm. When I talk about my near-death experience, it lives in me. I feel it once again, and I'm feeling it right now. Right? Mm-hmm. Could it be, is it possible that dying is the safest thing you could ever go through? Mm. What? We're terrified of death. That's a big reason MAiD is so popular. A lot of people seem to support it. But the question is not, how do you want to die? Would you like a professional to take care of it? Or how would you feel about dying if pain was properly managed, you had community around you, and excellent medical care and your comfort, right? When you change the question, you change the answer. And then when you introduce psilocybin and guided meditation, game changer. Now, I am a drug virgin. I've never even had a toke. Right?
Oh, right.
I've never
start up a drink.
Right? I've never smoked a cigarette. And I have a glass and a half of wine, and I'm going to bed. Mm-hmm. So no fun at parties. But I'm excited about this approach to palliative care, this introduction, psychedelics. Now, I want to emphasize, I wrote this book because of my moral distress. I retired because of MAiD. I could no longer function in a system that does this. And I had to wrestle with my vocabulary and terminology so it would be accurate. Because if you don't have accurate words to describe a morally distressing situation, you just cause more and more moral distress. So I use the term euthanasia, which is not a bad term. It means a good death. I talk about the roots of euthanasia and how Canada is approaching it, oblivious to the deepest dimensions of it. And no wonder we live in a culture where clergy have dropped the ball, not talking intelligently to our culture. The church unaware of ego deconstruction and that dynamic, unless you go to the Buddhist tradition, they're the wisest in spiritual psychotherapy. Just the poverty of comprehension in this culture. I'm not surprised MAiD is here. That book is an investment in our cultural capital. I'm hoping it slows down the expansion of MAiD. I hope it opens people up to talk about death, go to death cafes, think about your own mortality, ask the hard questions.
I think when I came into this conversation, I thought that maybe this was more from like the spiritual religious perspective of like, hey, like we don't want to prevent, you going through this transition into the afterlife or what, some sort of like idea like that.
Well, you get to those gates, St. Paul's going to be like, we're going to throw in your VHS. We're going to watch the life review.
But I want to add, like the thing that I find really interesting is I think about my experience in going to therapy, and I'm a very like rational sort of overthinker. And my therapist, I feel like, is constantly trying to get me to like shut off the sort of rational thinking brain and just start to like feel it. And we do a lot of EMDR, which is really helpful for me. And
what drug is that? That sounds fun. What is it?
Eye movement desensitization.
So when I think of what you're talking about, for me, I always go back to Audrey Parker's experience with MAiD and like this incredibly beautiful conversation that we had with her, this beautiful experience that she had. And when you talk about, people planning out this moment and like, it feels like a really amazing celebration. I understand what you're saying when you talk about this idea of like rationalizing and planning that, and the difference between my partner and I, we lost her dad a couple months ago, and it's been like an incredibly challenging process. And I think in thinking about what it might have been like to be able to plan his death versus going through the unexpected experience, it's been so hard. And at the same time, there has been a lot of beauty to the grieving process and the way that the community shows up in a way that's not planned. It's not rational.
It's organic. It's lovely.
Yeah.
So let's talk about Audrey, who is such an incredible woman. I had several conversations with her. I'm so grateful for her. And I'm even grateful for how she deepened the conversation around medical assistance in dying and what it is to die, and her heart passionate to advocate for others. Now, she died wanting to be in control, and she told me that's true to my nature, true to form. With MAiD on the table, it's like an irresistible drug. When the ego contemplates its own destruction, it's going to reach for that. So I would expect MAiD is really going to grow. Right now, Canada leads the world. 50,000 people have died by MAiD.
Wow.
In California, 1,000 people did it in 1 year. We had thousands upon thousands.
Wow.
Now, Audrey and anyone who has died by MAiD, I want to emphasize, I'm making no judgment upon their choice because they and the legislatures and the medical practitioners are not aware of ego deconstruction and psychospiritual processes. And I'm not saying it affects their afterlife. That's beyond my scope of practice, right? And I certainly trust that the grace on mystery on the other side is going to completely understand. The moral weight of it remains with us on this side of the grass. So anyone who's chosen MAiD, God bless you, go to the great beyond. I've supported those people, but I can do so no longer. I'm hoping that it is a temporary development in our spiritual understanding around death. I don't know where it's going to go. I'm grateful to have learned from all the people I've supported. They helped me write this book because of the lessons they taught me, and they're teaching me about my own humanity. Now, guys, check in on me when I'm on my deathbed. See if I have the same position. I don't know. Will I be able to face suffering? Will I be wise about pain medication?
It sounds like
You're too tall not to.
But it sounds like the argument that you're making is like that if you we've made MAiD available, we've made MAiD available, and if that is the choice that somebody makes, there's all these things there's all these like really positive things that we can put around that, like the community and like the ability to do this in this way that you're in control of, and that you can say your goodbyes, and you can do all these things with your community and with your family and whoever. And then, and that not necessarily that is a bad thing, but that we're stopping before we get to this turning point that you can only understand or access with a quote unquote natural dying experience.
Yeah, and there's a massive cultural impact. When a suicide happens, as tragic as that is, devastating, it does not affect, cumulatively it does, but it does not affect the culture like a single MAiD case. I see MAiD as this massive withdrawal from the cultural capital of our society, the spiritual intelligence. It's a withdrawal. It's not an investment.
It's almost like, would you use the word like avoidance in a sense where like you're almost avoiding the...
I would. Using terror management theory, which says we take what we're terrified of and objectify it. So we project it out. And we do that with death. It's a form of entertainment. Terror management theory identifies how the personal identity, ego identity, or you could even say collective consciousness of a culture will do anything to avoid what's in the subconscious. The fear of death is a massive amount of material there, and MAiD is a manifestation of that avoidance.
This sounds like my therapy sessions, and I mean that truly. Like, one of the things I've come to learn in therapy over the last couple of years is that I don't like to feel my feelings, you know? And when I'm feeling a feeling that isn't one that relates to positivity, I push it away. And I've also come to learn that habit has done nothing good for my life. It's only brought on,
More feelings
hurt
that you'd
and-
rather avoid.
Yeah, exactly. Yeah.
Who among us has a good model of anger in our life story? Have we had a good teacher of anger? Have we had a good teacher of passion and sexuality?
Hulk Hogan.
I mean, I think about that. I think about those things like a lot as a relatively new father, is that like, there's so many aspects of the emotional spectrum that we say like these ones are good and these ones are bad, you know? So like if a child is angry, we're like, don't be angry. Don't get upset. It's okay. Instead of developing like language with a child that allows them to feel those feelings and work through them and understand what that piece of the emotional spectrum is and how to
How can we
deal
do
with
that as we die? How can we gauge our fear and our grief? And let's not underestimate it. Those loved ones go through anticipatory grief because they prepare to say goodbye to one person. That dying person goes through preparatory grief, exponentially greater because they prepare to say goodbye to reality. So can you turn towards death and welcome it to the table, and turn towards your feelings and your anxiety and welcome them? Don't fix them or suppress them or project them, and say, I have these feelings, but they don't have me because they flow by. They're all temporary. Can I step back and observe my own experience even as I die? And can I allow myself to be broken and beautiful and give myself to the mystery that brought me into the world? I don't know how. Good. It's not about knowing how.
Yeah.
It's about opening and being present.
Right.
In some ways, is it not about the person dying? So like, let's say the person who is dying doesn't believe in any afterlife. They just think that when you died, that's it. They don't care at all if they do MAiD and it's over and that's whatever. But it sounds almost in some ways that this really has an impact, and you've used the word a lot, cultural impact of doing this. But is it more so about how it affects the community grieving that person to some extent?
We can't downplay the effect it has on grief. While some studies seem to indicate that people grieve more effectively and calmly after a MAiD procedure, a lot more studies show that you get complicated grief. And there is a sense of moral distress that they're not able to articulate because the society condones MAiD.
And right? I could see how someone might think, you know, like you have this experience you plan for and you feel good about that because you almost didn't have to feel those feelings that you don't want to feel. And so you feel good about that. But what is the sort of like deeper subconscious?
So MAiD becomes an effective existential analgesic. It really reduces the fear of death because now you've got control. And it reduces the fear of grief because the family feels like you're back in power and they're honoring you. But this is a return to ego identity and a surface level of engagement with death. We're talking about the ultimate mystery. In this day and age when we pretty much should be able to make death as smooth as possible, right? Well, it's a reflection of so many layers of impoverishment. Only 30% of people have access to good palliative care. The quality of that care still is not being adequately measured. I want to see the numbers. In this country, we should be able to provide it to everyone.
So for the folks, and before we wrap up, you know, for the people out there that are listening, which I'm sure there are a few that are listening to this and are on the side that they feel like perhaps they don't agree with what you're saying, or they find what you're saying very controversial. I would love to hear you talk a little bit more about this idea of transpersonal states of awareness that people experience as they are going through the dying process naturally. And I ask the people that do feel that right now, just to hear this with an open mind and to try to just allow allow these examples to come in and just think about it. Just be open to thinking about and meditating on what that means, what that could be like, what that, you know, what questions does that bring up for you as it pertains to what the all of this is? What is our experience? Like,
Right.
what does this mean?
So let's go there, but base it in science, not in
Yes,
religion and
please.
mysticism.
Yeah.
So the most robust model of reality, which a lot of scientists, prominent ones, now embrace, is simulation theory, that we live in a simulation.
Now you just all those people that already were like, I don't know. Now they're like, oh, now I really don't know.
Yeah, no,
but this is legit.
Okay, so we can appreciate that just by realizing what you see is not what you get. I can see things in the visible spectrum of light, but I can't see anything beyond that. There's so many frequencies of reality and of consciousness, but it's all distorted by my biological apparatus to facilitate only one thing, my biological survival, right? Procreation. To assume this is all there is in terms of consciousness is really understandable when you're not aware of the research. The research into near-death experiences and mystical phenomenon show that it's been going on across all cultures and time periods, independent of your belief system. And it reveals not is there a God, but what is the nature of consciousness. So I want to emphasize that. It's not as weird as it seems. Second point is that you don't need to die to experience this. We get little glimpses of it through life. And dig a little deeper into those coincidences and non-ordinary states of consciousness and investigate. So when you die, does it matter then how you die, if it's all just a simulation? Well, according to now we're going to the spiritual traditions, yes, it does. Your final thoughts, right? Your intention, as well as a whole matrix, if I can use that term, of a constellation of factors that boil down to one thing. How am I part of it all? If I'm part of it all, can I trust the process? The poverty of my words are not going to adequately express this for your listeners. I hope that my 175,000 words in the book adequately express it, because this is grounded in good research at the end of life. Mystical phenomenon are practically universal. I experienced it. Both my parents experienced it. I've witnessed hundreds of people experience it. It's beautiful. It's safe. It's lovely. I'm saying MAiD will compromise the ability to reach that state and his movement in the opposite direction. But I'm not saying that MAiD compromises your existence or health in the afterlife, whatever that's going to be.
What I would really love for just the general public is like a piece of this conversation that's been around the deterioration of the ego and all the talk about like how the ego comes into form, and then how we talk about disintegrating it, and how it and how there is a transcendence of that ego in the
So I can do that real quick for you.
And I just want I know that you're writing and what you're about to say is going to be helpful for people in that. And I definitely don't claim any type of like specific expertise in this area. But having been exposed extensively to spiritual practices through the world of yoga that I was immersed in for a very long time, I found that the understanding of the ego, whether it's from a spiritual perspective or whether it's from a scientific perspective and how it's been studied by psychologists through the centuries, is that understanding of what it is something that is just generally lacking in the general population. And making that step to understanding the ego more is such a bridge to understanding conversations like these and things like that, and things that you've talked about, not just in this book, but in all of your work.
And that's going to make this book and its message a hard sell. I've got to cover a lot of ground. So how old is your...
She is
23 years old.
Almost 11 months.
She's 11 months. Okay. So ego formation occurs when we are born in the first few months or maybe 2 years of life. First, there is a contraction of consciousness away from unity. No longer one with the womb, you're now in an environment. So there is a separation. And then another separation in which you realize there are different types of objects in the environment, those that move and those that don't, like this wonderful dog or like you and me. So separation, differentiation. This is contracting to form sense of self in the world. Third contraction is mind and body. I realize I seem to be behind my eyes here. And so now there's that split. Fourth split is the big one. That which I can integrate into my ego supports my identity, and that which I cannot goes to my subconscious to become my homework later in life. And I keep piling stuff in that warehouse. Anything that threatens the integrity of my identity, I'm either going to attack or suppress. Maybe I'll just go neutral and numb over it. Or can I engage it to grow my ego and sense of personal self in the world? When challenges come along, they threaten the integrity of my identity. Like when a sister is born, change my place in the family, move to a different grade, lose a girlfriend, lose another girlfriend, right? Lose another girlfriend. Then when I lose my job and I lose my marriage and I lose my keys and I lose my hair, my functioning, all this threatening my ego identity, my relationship to my body. So these break down the barriers, which sucks, but they open me, returning me eventually at death to the unity with all things, which never left. So this is a psychospiritual dynamic that's universal in the world, but very strong in Western culture where we emphasize the individual. No wonder we have so much struggle with this process. Dying, this is what I mean when I say dying calibrates us through the deconstruction of ego identity for the final state of consciousness, which is unity with everything. I've lost track of how many people I've been with as they die who feel that unity, and they're not able to put it into words, but we know it. And they'll say such things as, I'm actually okay with this, or you wouldn't believe how peaceful this is, or I've let go of everything and I feel so light. I'm curious about what's on the other side. They're still grieving, right? They're still sorrowful, but they're also part of this mystery and opening to it.
Well, David, thank you for taking us to church and giving us a beautiful, beautiful sermon there. Folks, Early Exits, Spirituality, Mortality, and the Meaning in an Age of Medical Assistance in Dying. It is available now. I highly, highly suggest you go and grab a copy. And especially if this is something that you feel like you disagree with, because I think in a world where we have been pushed and molded and shaped into these individuals who are essentially being taught to take anything that we don't agree with and to just crumple it up and throw it over our shoulder. I think that's doing us a massive disservice. And I think that it's investigating and being open to hearing all aspects, all sides, all understandings of a particular topic. I think that's where society is going to have this evolution of just being far less in a state of dis-ease and discomfort. And I really appreciate you, for writing all of those letters down in that book, but B, also for always being up for coming on the show and just opening our minds up to the world of spirituality and death and dying and the beauty that exists within it. David, how can people find you if they want to stay up to date with the work that you're doing?
You can go to davidmcginley.com. I'm revamping the website. It's not adequate now, but there it is. I'm on Instagram, Facebook, all the requisite noise that has to be created around these things. I have a private practice here in Halifax. And thank you for deepening the conversation. Thank you for asking me to come and talk about the most controversial issue in healthcare. I look forward to hearing what people think, and let's be compassionate and respectful, but let's not shy away from the hard work we have to do.
Thanks, man.
Thank you.
Thank you.
You're gonna fall down. Boom. There we go. That was friggin'